Ever find yourself wanting to get the real core of a tricky subject, but, without drowning in all the technical bits?
Yeah, that's exactly what we try to do here.
And today we're tackling something that sounds pretty scientific, ethylene glycol toxicosis. But it's actually super relevant, especially if you've got pets.
Absolutely. Ethylene glycol toxicosis. Bit of a mouthful, right?
Yeah.
But basically, we're talking about antifreeze poisoning.
Hmm.
Ethylene glycol, that's the main ingredient in most antifreeze. And it might seem niche, but it's a really common and, frankly, devastating issue for dogs and cats.
It really is. We've got some detailed sources on this, and our goal today is to pull out the absolute must-knows for you. We want to get a handle on just how dangerous this stuff is, what it actually does inside an animal's body, and why getting help immediately is, well, everything.
Exactly. It's all about speed.
Okay, so let's jump in. What exactly is this toxicosis?
Right. So fundamentally, it's poisoning from swallowing something with ethylene glycol. And 9 times out of 10, maybe more, that something is antifreeze.
Okay, so pretty much always antifreeze.
Pretty much. It's rarely some other industrial chemical in the typical pet scenario. The real trouble starts once they swallow it because it gets absorbed incredibly fast from the gut.
Super fast absorption.
Yeah, really rapid. Although, interestingly, if the animal has food in its stomach, that can slow things down just a bit. But only slightly.
So it gets in quick, then what? What are the immediate effects?
Well, first, the ethylene glycol itself causes some problems. It acts as a central nervous system depressant. So think like grogginess, acting drunk.
Like being intoxicated.
Exactly. Ataxia, that wobbly gait.
Hmm?
Also, irritation in the stomach and intestines, maybe some vomiting. And you often see increased thirst and urination initially.
Okay, but you said that's just the start.
That's just the start. The really bad part is what the liver does next. It rapidly metabolizes the ethylene glycol using an enzyme called alcohol dehydrogenase.
Right.
And this conversion process creates a chain of, well, increasingly toxic metabolites. First glycoaldehyde, then glycolic acid, glyxalic acid, and finally oxalic acid.
Wow. Okay, so the body trying to break it down actually makes it worse.
Precisely. These metabolites are the real culprits. They cause severe metabolic acidosis. Basically, the blood becomes dangerously acidic, and they inflict major damage on the kidneys. It's a cruel irony, really. The body's detox process unleashes the real poison.
Yeah, that's nasty. And you mentioned it's potent. How much does it actually take?
It's genuinely shocking how little. For cats, the minimum lethal dose is estimated around 1.4 milliliters per kilogram of body weight.
1.4 mil per kilo. That sounds tiny.
It is. Think about an average cat, maybe 4 or 5 kilos. We're talking maybe a teaspoon, maybe even less, could be fatal.
A teaspoon?
Yeah. And for dogs, it's a bit more, around 6.6 milliliters per kilogram. But still, that's not a large amount, especially for smaller dogs. It just highlights how incredibly careful you need to be. Any spill, any access is potentially deadly.
That is terrifyingly small. So, okay, which body systems really take the hit here?
Several systems are affected. The GI tract, as I mentioned, gets irritated.
Yeah, the vomiting.
Yeah. Then the nervous system, you get that drunkenness or inebriation from both the ethylene glycol itself and that first metabolite, glycoaldehyde. It messes with breathing, how the body handles glucose and serotonin, things like that.
Okay.
But the kidneys are the main target. Initially, you get that increased urination because the ethylene glycol acts as an osmotic diuretic, draws water out.
Right, the increased thirst and urination you mentioned.
Exactly. But then comes the really critical damage. Those later metabolites, especially oxalic acid, combine with calcium in the body to form calcium oxalate monohydrate crystals.
Crystals inside the kidneys.
Yeah, tiny sharp crystals forming inside the kidney tubules.
That's
It's like microscopic shards of glass damaging the cells lining those tubules.
Ouch.
And it's not just physical damage, like clogging. The current thinking is that the oxalate actually attaches to the cell membranes, triggers harmful enzyme activity, and generates damaging free radicals. Basically, it directly attacks and kills the kidney cells.
So it's a chemical attack at the cellular level, too. No wonder it causes kidney failure.
Exactly. Acute kidney failure is the major, often fatal consequence.
Just devastating. And how often does this happen? Is it rare or?
Sadly, no. It's alarmingly common in small animals, and it holds the grim title of having the highest fatality rate of pretty much all poisonings reported in pets.
Highest fatality rate. Wow.
Yeah, and cats often fare worse than dogs. Their fatality rate tends to be even higher. Though, interestingly, the actual number of cases, the incidence, is pretty similar between dogs and cats.
And I guess location matters. Colder places, maybe.
Definitely. You see a much higher incidence in colder regions, logically tied to the increased use of antifreeze in cars during winter.
Makes sense. It's primarily an antifreeze issue.
Overwhelmingly.
And is it just dogs and cats?
Mostly, they're the most common we see.
Mm.
But technically, other species can be affected too. Even birds have been reported. And it's not just, puppies or kittens or very old animals. The age range is wide recorded from 3 months up to 13 years old. The average age is around 3 years. So really, any dog or cat is potentially at risk.
Okay, so a widespread threat. Let's talk about signs. What should someone be looking for? What are the red flags?
Right. Well, the signs depend a lot on how much they ingested, and they almost always come on suddenly, acutely. And remember, the signs are caused by both the original ethylene glycol and those toxic metabolites that form later.
Okay, so what happens early on, say the first few hours?
In that early phase, maybe 30 minutes to 12 hours after they drink it, you'll often see things like nausea, vomiting, depression, which can be mild or quite severe, that ataxia, the stumbling, drunk-like behavior.
Right, the inebriation.
Exactly. Also, maybe knuckling over on their paws, muscle twitching, sometimes rapid eye movements, that's nystagmus head tremors, decreased reflexes, and that initial increase in urination and thirst we talked about.
A lot of those sound like they could be other things too initially.
They absolutely could. That's part of the challenge. And there are some differences between dogs and cats, even in this early stage.
Oh, like what?
Well, with dogs, as they get more depressed, they might actually start drinking less, even while they're still urinating a lot, so they can get dehydrated quickly.
Okay.
And here's the tricky thing. Sometimes in dogs, those neurological signs, the drunken stumbling, might seem to get a bit better around the 12-hour mark.
Really? So they seem like they're improving?
Yeah, temporarily.
Ugh.
But it's often a false improvement, and the signs usually come back worse later. With cats, they tend to just stay really depressed from the get-go, and they typically don't show that increased thirst that dogs often do.
Huh. That temporary improvement in dogs sounds really dangerous. Could give false hope.
It absolutely can. It's insidious.
So what happens if it's missed or not treated quickly? What are the later signs?
This is when the kidney damage really kicks in.
Yeah.
Urine production starts to drop off dramatically. That's called oliguria. Or it might stop completely, anuria.
And how quickly does that happen?
It's frighteningly fast. In dogs, oliguria might start around 36 to 72 hours post-ingestion. Anuria, no urine, maybe 72 to 96 hours. But in cats, it's even quicker. Oliguria can show up as early as 12 to 24 hours.
Wow, cats progress much faster then.
Much faster towards kidney failure signs. Other late-stage signs are really serious. Severe low body temperature, hypothermia, extreme lethargy, maybe even coma, seizures, total loss of appetite, more vomiting, sometimes painful ulcers in the mouth, excessive drooling.
REM.
And if a vet examines them at this stage, the kidneys often feel enlarged and painful when palpated, especially in cats.
This just paints a picture of a terrifyingly rapid decline. Time is absolutely critical.
Couldn't be more critical.
We know antifreeze is the main source. Are there other specific risk factors? Like, why does it happen? Is it just spills in the garage?
Well, the main cause is swallowing ethylene glycol, which, is 95% of most standard antifreeze,
Right.
the risks. First, it's just so widely available. Lots of people have it stored. Second, it actually has a slightly sweet taste. Animals might be attracted to it. They might lick it up willingly.
Oh, that's awful. A sweet poison.
Yeah, it's deceptive. Then, as we said, that tiny lethal dose doesn't take much. And finally, honestly, a big risk factor is just a lack of public awareness about how incredibly toxic it is.
People just don't realize.
Exactly. And yes, spills in the garage are common, but think about leaky radiators dripping onto driveways, or people improperly discarding old antifreeze, maybe leaving containers open. Even a small puddle can be enough. Thorough cleanup and secure storage are key.
That awareness piece is huge. Okay, so if an animal comes in and the vet suspects this, how do they confirm it? Those early signs sounded pretty nonspecific.
That's a really important point. Diagnosis can be tricky, especially early on. The initial signs, they can look like alcohol poisoning, ethanol, or methanol, even marijuana toxicity sometimes, or metabolic problems like diabetic ketoacidosis, or just bad gastroenteritis or pancreatitis.
Lots of overlap.
Definitely. And later, when you've got kidney failure, you have to differentiate it from other things that cause kidney failure. Other toxins, infections like leptospirosis, underlying chronic kidney disease, poor blood flow to the kidneys. The list goes on.
So you really need specific tests.
You absolutely do.
Yeah.
Standard blood work and urine tests are the first step.
What do they typically show?
Okay, so on the CBC and chemistry panel, you might see signs of dehydration, like a high-packed cell volume, high total protein, often a stress leukogram, which is just a pattern of white blood cell changes showing the body is under stress.
Right.
The key things are the kidney values, BUN and creatinine. They start to climb, showing the kidneys aren't filtering waste properly. But the timing's different, remember. Takes longer in dogs, maybe 36, 48 hours, but can be as early as 12 hours in cats.
Okay, BUN and creatinine go up. What else?
Phosphate levels can be interesting. Sometimes they're high early on, which might actually be from rust inhibitors in the antifreeze itself. But persistently high phosphate usually means kidney failure is established. Potassium can get dangerously high if the animal isn't producing urine.
And calcium. You mentioned the crystals bind calcium.
Yeah, you'd think calcium would always be low, and it is low in about half the cases because the oxalic acid grabs it. But strangely, you don't always see the classic signs of low calcium, probably because the acidosis counteracts some effects.
Huh. Okay. Anything else in blood work?
Blood glucose can be high in about half the cases, too, due to all the metabolic chaos going on.
And the urinalysis. That sounds crucial with the crystals.
Hugely important. One key early finding is isostenuria. The urine is dilute, not concentrated. The kidneys lose that ability. Initially, it's partly due to drinking more and the osmotic effect, but later it's pure kidney damage.
Right, and the crystals.
That's the big one. Calcium oxalate crystalluria. Finding those crystals in the urine sediment, they can show up really early, maybe 3 hours after ingestion in cats, 6 hours in dogs. And it's usually the monohydrate form, which looks like little picket fences or dumbbells under the microscope.
So finding those crystals is a major clue.
A very strong clue, yes. Also, the urine pH is usually consistently low, so acidic. You might see other things too, like blood, protein, glucose in the urine, maybe some casts or cells, but those can be more variable.
Okay, so the crystals are key. Are there even more specific tests?
Yes, definitely. Blood gas analysis is really helpful. It'll show that severe metabolic acidosis, low CO2, low bicarbonate, low blood pH. You'll also see the body trying to compensate by breathing faster, so the PCO2 level in the blood will be low.
Okay.
And a really significant finding is a high anion gap. That's a calculated value that basically reflects the presence of those unmeasured toxic anions, glycolic acid, oxalic acid, etc., in the blood.
So the anion gap points towards these hidden toxins.
Exactly. It's a very important indicator. Oh, and something to watch out for. Glycolate, one of those metabolites, can sometimes mess with lactate tests, making the lactate look falsely high. So you have to be careful not to misinterpret that.
Good point. What about osmolality? You mentioned that earlier.
Right. Serum osmolality and the osmol gap.
Yeah.
Early on, before the ethylene glycol is metabolized, it increases the osmolality of the blood, the concentration of dissolved stuff. So you measure the osmolality and compare it to what you'd calculate based on normal substances. The difference is the osmol gap.
And ethylene glycol causes a big gap.
A very big gap, usually. It's one of the classic causes of a high osmolar gap. This is most useful really early, though, because as the ethylene glycol gets broken down, the gap decreases, even though the toxic metabolites are building up.
Makes sense. Can you test for ethylene glycol directly?
Yes, you can measure EG concentration in the blood serum. It peaks pretty fast, like 1 to 6 hours after ingestion, and it's usually gone from the blood after about 72 hours.
So you need to test early.
Very early for that to be useful. There are commercial test kits, like the REACT-EG test. It detects levels over 50 milli-GDL. Gives results quickly.
Useful then.
Can be, but with limitations. It doesn't detect metabolites, only the original EG. So again, best used very early. It's labeled for dogs and cats. But importantly, some cats can be poisoned even with levels below that 50 milli-GDL detection limit.
Ah, okay. So a negative test doesn't completely rule it out in cats.
Not absolutely, especially if the timing's uncertain or if they ingested a smaller but still toxic amount.
Yeah.
Also, things like propylene glycol or glycerol can sometimes cause false positives with some kits.
Any other quick tests? I've heard about using a black light.
Yeah, the Woods lamp. Some antifreeze has fluorescein dye added, which glows under UV light. So you might see fluorescence in urine or maybe on the animal's face or paws or in vomit, but it's really unreliable. Not all antifreeze has the dye, and other things can fluoresce too. So not a definitive test at all.
Okay, so not something to rely on heavily. What about imaging? Ultrasound.
Ultrasound can sometimes help. It might show changes in the kidneys, like the outer part, the cortex, looking brighter, more hyperechoic. That can suggest those crystals are present in the tissue.
And more invasive things. Biopsies.
If an animal has completely stopped producing urine and the diagnosis is still uncertain, a kidney biopsy can give a definitive answer by looking for the characteristic damage and crystals in the tissue. Also, just pressing a microscope slide onto a cut surface of the kidney sample An imprint cytology can often show the crystals quite clearly.
Right. So diagnosis is complex, but definitely doable if you put all the pieces together.
Exactly. History, clinical signs, blood work, urinalysis, maybe specific tests if available and done early. It's detective work.
Okay, let's shift to the most critical part, treatment. What can actually be done? It sounds like a real race against time.
It absolutely is. Speed and the right treatment are everything. Cats almost always need intensive inpatient care. 24/7 monitoring.
Always hospitalized for cats.
Pretty much always. For dogs, if they're treated very, very early, we're talking less than 5 hours after ingestion, and you use the specific antidote, maybe outpatient could be considered. But honestly, most dogs need hospitalization too, for IV fluids and supportive care.
Okay, so what are the main goals of treatment?
3 main things. 1, stop any more toxin being absorbed. 2, help the body get rid of what's already absorbed. And 3, the most crucial, stop the liver from turning the remaining ethylene glycol into those really toxic metabolites.
What about making them vomit? Or using activated charcoal, isn't that standard for poisons?
Usually, yes. But with ethylene glycol, it's absorbed so incredibly fast that inducing vomiting or giving charcoal is generally only helpful if you can do it within maybe the first 30 minutes. After that, it's likely too late for those to do much good.
So fluids are key then.
Intravenous fluids are absolutely essential. They combat dehydration, help keep blood flowing to the kidneys, kidney perfusion, and promote urination to try and flush the system out.
Makes sense.
And we also usually need to give bicarbonate intravenously, slowly, to correct that severe metabolic acidosis. There are calculations to figure out how much they need, and you have to monitor their acid-base status and urine pH closely during therapy.
Right, managing the acidosis. What about if the kidneys have already started failing? Like if they're already azotemic or not producing much urine?
Yeah, in those later stages, say a dog comes in already showing signs of kidney failure, azotemia, and low urine output, oliguria, most of the ethylene glycol has probably already been metabolized, so giving the antidote to block metabolism is less likely to help much at that point.
So what do you do then?
The focus shifts entirely to intensive supportive care, managing fluids, electrolytes, acid-base balance very carefully. Trying to get the kidneys working again, maybe using diuretics like mannitol to stimulate urine flow, though that doesn't always work.
Yeah.
And if available, considering more advanced things like dialysis, hemodialysis, or peritoneal dialysis to filter the blood artificially.
Dialysis, like for humans?
Exactly. It can bridge the gap while the kidneys hopefully recover. But recovery from severe kidney injury can take weeks, and sometimes function doesn't fully return.
Wow. And you mentioned kidney transplants earlier for cats.
Yes, surprisingly, kidney transplantation has actually been done successfully in cats that developed end-stage renal failure, specifically from ethylene glycol. It's obviously a very specialized high-level procedure, but it's an option in some centers.
Incredible. Okay, let's talk specific drugs. The antidotes. What are the main choices?
Right, the antidotes work by blocking that key liver enzyme, alcohol dehydrogenase, preventing the formation of the toxic metabolites. The drug of choice, especially for dogs, is Fomepizole.
Fomophorol, also called 4-MP.
Yes, 4-methylperazole, or the brand name is Vet. It's very effective, it works directly on the enzyme, and it's generally not toxic itself. It is more expensive than the alternative, ethanol.
Oh.
Yes, regular alcohol, ethanol. Fomepizole is pricier, but it generally requires less intensive monitoring than ethanol treatment. There's a specific dosing schedule for dogs, an initial IV dose, then smaller doses, IV at 12, 24, and 36 hours later.
Okay. And for cats?
Fomepizole works in cats too, but they need a much higher dose.
Yes.
Significantly higher initial dose than the follow-up doses at 12, 24, 36 hours.
So Fomepizole is preferred if available. What if it's not? Then ethanol.
Exactly. If Fomepizole isn't available, or maybe cost is a major barrier, then ethanol is the alternative. It works the same way it competes with ethylene glycol for that same liver enzyme. Alcohol dehydrogenase actually prefers ethanol.
So the enzyme gets busy with the ethanol instead.
Precisely. But ethanol therapy is much trickier. You have to give it as a very specific, diluted intravenous drip, often continuously or in repeated doses for quite a long time, potentially days, to maintain a constant therapeutic blood level. And because it's alcohol, it causes significant sedation and requires very close monitoring in an ICU setting.
Right, more intensive care needed for ethanol. Are there any situations where you wouldn't use these antidotes? Or specific warnings?
Well, you need to be cautious with anything that further depresses the central nervous system. Ethanol itself causes CNS depression, so you have to watch breathing really carefully.
Okay.
Fomepizole causes minimal CNS effects in dogs, maybe slight sedation in cats at their higher dose, so that's an advantage. Cats are also really prone to getting cold hypothermia during treatment, so keeping them warm is vital.
Keep cats warm. Got it.
And it's crucial not to use other types of pyrazole compounds, as some could be toxic to bone marrow or the liver. Stick to Fomepizole.
Right. So careful monitoring is the name of the game, whichever antidote is used.
Absolutely. Especially with ethanol, you're balancing keeping the enzyme blocked with not causing excessive sedation or other complications.
Okay, so let's say an animal gets through the initial crisis. What's the follow-up like?
Close monitoring is still needed for a while. Daily checks of kidney function, BUN, creatinine, looking at their acid-base status, keeping an eye on urine production, making sure things are trending in the right direction.
And the most important part, how do we stop this from happening in the first place? Prevention.
This is the most important message. Prevention. Number one is increasing owner awareness. People need to know how incredibly dangerous antifreeze is, even a tiny lick.
Spreading the word.
Exactly. Secure storage, immediate cleanup of any spills, no matter how small, and crucially, promoting the use of safer antifreeze products.
Safer alternatives.
Yes. There are antifreeze products available that use propylene glycol instead of ethylene glycol. Propylene glycol is much, much less toxic to pets. Brands like Sierra or Prestone Low Tox are examples.
So switching to propylene glycol antifreeze is a key step.
A massive step. If people just switched to propylene glycol-based antifreeze, it would prevent so many of these tragic poisonings. It's a simple choice that saves lives.
That seems like a really actionable takeaway for listeners. Check your antifreeze type.
Please do. It makes a huge difference.
What about long-term problems if an animal survives? Are there lasting effects?
If they get through it without developing severe kidney damage, with that azotemia setting in, then usually, no, there aren't long-term complications. They can make a full recovery.
That's good news.
However, if they do become azotemic, meaning significant kidney damage occurred, even if they survive, their kidney function might not return completely to normal. Specifically, their ability to concentrate urine might be permanently reduced to some extent. They might need ongoing management for chronic kidney issues.
So recovery is possible, but maybe not always 100% if the damage was severe.
Exactly. Some lasting impact is possible in those cases.
Okay, let's summarize the prognosis then. What's the expected outcome?
Well, untreated, it's grim. Rapid progression to kidney failure, no urine production. Usually fatal within days 36-72 hours for kidney failure signs in dogs, 12-24 hours in cats.
What with treatment?
With treatment, it depends entirely on how fast you act. For dogs, treated within, say, 5 hours with Fomepizole. Excellent prognosis. Good chance of full recovery.
Within 5 hours is key for dogs.
Yes. Even up to 8 hours, most dogs still recover if treated aggressively. Treatment might still offer some benefit up to 36 hours by stopping further metabolism, but the earlier, the better.
And for cats, that shorter window.
Much shorter window for cats. Treatment within 3 hours gives a good prognosis. But if they ingested a large amount, the prognosis is poor unless you start treatment within maybe 4 hours. It's incredibly tight for cats.
Wow, 3 or 4 hours, that's not much time at all.
Not much at all. And if the animal, dog, or cat already has established kidney failure, azotemia, and oliguria by the time they get treatment, the prognosis is unfortunately poor. The irreversible damage has largely been done by then.
So the take-home message is really, really clear here.
Crystal clear, I hope.
Ethylene glycol is incredibly toxic, even tiny amounts. It works fast, it's devastating, especially to the kidneys. Early signs can be missed, but acting immediately, getting veterinary help instantly, is the only chance.
Absolutely. Minutes matter.
And that high fatality rate just hammers home how vital prevention is. Knowing about it, cleaning spills, secure storage, and crucially, choosing those safer propylene glycol antifreezes.
That's the key. Awareness and safer choices.
This deep dive really highlights those hidden dangers potentially lurking in everyday places. Makes you think, doesn't it?
It really does. A stark reminder about seemingly harmless things around the house.
Yeah, and it kind of prompts that question. Beyond antifreeze, what other common household items might pose risks we haven't considered for our pets or even for us? It's definitely motivation to stay informed, stay vigilant, right?
Absolutely. Keep asking questions, keep learning. It's the best protection we have.